I'm I am with the Education Development Center, started in December, but previously was working with the Colorado Department of Public Health and Environment on this same project. So I feel really fortunate that I get to continue to work on this because, yes, it is one of my favorite projects that I've been able to work on across my career. So if you hear me say we in different contexts when referring to CDPHE, that's why, because it's still kind of new, that transition. It's a really great question about what kind of drew me to this work. I would say professionally, I started out doing evaluation in a community mental health center. So really that individual level, looking at families and looking at youth, children and families. And so I really enjoyed that work and knew that I was passionate about evaluation and capturing the impact of the work that we do. But in going back to school and getting my master's in public health, got really excited about this public health approach and doing primary prevention. And then in working with the Colorado Department of Public Health, one of the things I feel really fortunate about is I worked with some really brilliant colleagues who were very adept at understanding this kind of shared risk and protective factor approach. And so that's thinking about that nexus of what are these upstream determinants that are shared across multiple outcomes. How can we be really strategic about the little resources we have for prevention so that we can have an impact across these different outcomes. And then, yes, I have to agree that this participatory approach that we're able to use with the CNC, it feels like the first time in my evaluation career that I got to really fully implement that and have the way that I evaluate really align with my values and what I think equitable evaluation should look like. So I think that's what gets me really excited.
All right, thanks, Felice. So I'm going to cover most of just the framework. So what is the Colorado National Collaborative? How did we get here? So I'm going to talk about that kind of globally, and then I'm going to turn it over to Felice because, as she mentioned, she comes directly from Colorado, so she knows a lot about what was happening on the ground. Next slide, please. All right, so the Colorado National Collaborative, we are currently CDC funded, so we're one of the comprehensive suicide prevention grants, which folks may already know about. But we were formed long before the CDC extended that funding stream. So I want to tell that story. We are a partnership of local, state, and national scientists, public health folks, all working together to reduce suicide by 20% by 2024 in Colorado. And our overall goal is to develop, implement, and evaluate a comprehensive strategy that can be replicated. And hopefully that would be nationwide. As of now, we're in the feasibility phase, right? Like this is new. This is a new approach, and we're testing it out. So this is not a controlled design. We understand all the methodological flaws that are associated with the work. We get it, but we want to know, can we implement this approach? Is it acceptable, feasible to the community, to the state, to the nation? Like, how does it all kind of fit together? How does that work? So that's the story we're looking to tell. Next slide, please. All right, so I'm going to tell the story of how the CNC came about because I think it's really interesting. So back in like 2016 or so, American Association of Suicidology, the AAS conference, a bunch of folks got together, and I think we're just kind of lamenting the state of suicide in our nation. We were seeing that rates were increasing. People were getting really frustrated. We're thinking we're doing such great work, but we're seeing suicide rates kind of on the rise, and they're just not getting any better. And so people were getting together, and they were like, okay, well, what works? What how can we think about this differently, and what can we do differently? And a group of national leaders and state leaders got together, and they said, what seems to be working pretty well is the Carrie Knox's work, right? The stuff with the Air Force. We know that, when we implement a comprehensive approach to suicide prevention, a public health approach to suicide prevention in a closed system like the Air Force, we're able to show that not only can we reduce suicide, but we can also reduce some of the other, public health issues that are of concern for us. So things like violence or substance misuse. And so, how do we replicate that model in a state or in a community? And so the group got together and started to think about that. And so they said, okay, well, where could we start implementing something like this? And they came up with the CDC's Injury Control Research Center for Suicide Prevention selected Colorado. And the ICRC, Injury Control Research Center, what they said was, okay, we don't really have a ton of funding, right? We can probably staff a little bit. So we need to find a state that has a lot of existing suicide prevention resources and can sort of start to braid things together. So not just in suicide prevention, but maybe opioid prevention. It's got some violence prevention going on. How do we braid all of that together? And so Colorado was selected to implement the project because, comprehensive approaches take a ton of funding, and they take a lot of skill in terms of being able to braid different funding streams together to direct it toward a common goal. And so that's what Colorado was really, really great for. Colorado had really great leadership already, people who were really skilled in braided funding. It had the buy-in. It had really good existing capacity. Their EPI department is incredibly skilled. Their OSP, their Office of Suicide Prevention, incredibly skilled leaders. And so, that's one of the reasons why we selected Colorado. So what we did first is we said, okay, well, Colorado's our state, right? It's got a burden, it's 10th highest in the nation in terms of suicide. So, we picked Colorado, then we said, okay, well, where are we going to implement this thing? And so what we did was we worked with the EPI team to produce a dashboard of sorts that can kind of take a look at the counties that are at highest risk of suicide, so we could really assess for which counties are going to have the highest risk of suicide, and therefore which counties can we implement this program in to produce some really good change. And so we identified 6 counties that had the highest suicide and opioid burden in which we would implement our programming. Then we did an environmental scan. We said, okay, these 6 counties have really high burden. What do they have in terms of capacity? What do they have in terms of infrastructure? Where's their resources? And we took a look to see where their existing funding was, and kind of what was already going on. What did they have the buy-in for? And using that model, we came up with 6 pillars that kind of define our strategy. And I'm just going to show you those pillars next. So next slide, please. All right, so what we said was, okay, we want to do an upstream, downstream public health approach to suicide prevention. And upstream, downstream means we're going to go all the way back to economic stability and supports, and we're going to work our way all the way forward to postvention and access to suicide safer care. We want it all on there. And so we took a look at, what the counties were doing already, what they already had funding for, and that in part defined this model. But also we looked at where the needs were, and so that defined it as well. We all got together in a room, and this was a joint decision. State leaders, local leaders, and national leaders getting together and saying, okay, what's our model going to be? And so this is the Colorado National Collaborative. These are the 6 pillars that we focus on. Next slide, please. So one of the things we like to say at Colorado in the CNC is that we've, at sort of the state and national level, kind of set the frame for the kinds of things that define the comprehensive approach in Colorado. But the individual counties have flexibility and freedom in terms of how it's implemented. El Paso is going to be very different than Larimer in terms of where their needs are, what their culture is, who's at highest risk. And so we didn't want to be too prescriptive in terms of, you need to do this activity and that activity with this person or that population. What we wanted to say is, okay, these are the short-term outcomes we're looking at. These are the midterm, long-term, et cetera, to move on to impact. And we want some evidence that, all counties are swimming in the same direction, that they're all working on these kinds of outcomes. And so that really kind of formed our frame as well, is that, that lack of sort of prescription. So there's a sort of overarching frame. If you think about it like a logic model, our logic model is such that, we've kind of produced that broader, structure, but within that there's freedom and flexibility for the counties. Next slide, please. Okay, so if we're going to have freedom and flexibility in the strategies, that creates some challenges in terms of the evaluation. It means that we really needed to do a participatory action approach, not only because it aligns with my values, Felice's values, and other folks on the team, but also because we need the capacity at the local level for folks to do the evaluation well. They're going to really need to be fully bought into the process in order to be able to evaluate that the unique approach that each of the counties is sort of bringing to the model. And so to that end, we did this participatory evaluation, which, like I said before, is a process by which we're really fully engaging everyone on our evaluation team as leaders. So that means we have open communication and peer sharing. That means, monthly meetings where we talk about challenges that we encounter, and we talk about, places where we're just struggling in the approach. It means shared decision making. So, when we set about establishing our metrics, which Felice is going to talk about, we had conversations about, okay, well, what would be, a feasible metric? What would be a meaningful metric for you? That sort of thing. We voted on metrics. So we did a big brainstorm of, okay, these are the metrics we have available. These are the metrics that, feel like they're, not too heavy a burden for folks. And we did some voting even, as we had those kinds of conversations. We have been thinking critically about data provision, ownership, decision-making, and influence, and that means having some really uncomfortable conversations about who owns the data, who uses the data, who's providing the data, who's getting funded by who. And so we did some mapping. Felice has a really great tool for that, where we, drew arrows from the national partners and the various folks involved in the Colorado National Collaborative. So you could see if there are a lot of arrows pointing, one way and none pointing the other, it says something. It says something about the equity of, of your approach. And so, we took that on and had some uncomfortable but very important conversations. I talked about minimizing burden. That's essential for us. When we were looking at our metrics, we tried to pick metrics that could be collected at the state level, because at the state level, we've already got some existing infrastructure for collecting the metrics, reporting out on the metrics, et cetera. So we wanted to stick with as many of those as we possibly could, particularly when we get to the midterm outcomes. A lot of our stuff that can be rolled up to the state level. Oh, and thanks. Felice put our We All Count tool in the chat. That's the tool that I was just referencing with regard to that shared decision making and how we kind of structure that conversation. And then there's capacity building and creating common language, which is something that we do all the time because there's a lot of turnover. These are community level folks working in very stressful times in a very stressful, public health is not an easy place to be right now. So there's a lot of burnout, a lot of turnover, and a lot of need to create, orientation materials, get folks onboarded. So we do a lot of that. We're also really interested in diversity, equity, and inclusion, which was built into our model from the get-go. But I think we're being a lot more intentional now about how we measure our success with regard to the objectives we've placed related to diversity, equity, and inclusion. And so we need to start with a shared language there too. And so we've got a Google Doc where, everybody's kind of placing their ideas about what needs to be defined with regard to DEI, so we can be sure we're all on the same page and singing from the same songbook when we're talking about DEI related issues, and particularly DEI related metrics. I think that's it with regard to this slide. Next slide, please. Okay. So, this approach is not without its challenges. We've got metric standardization being an issue. So making sure that we're all on the same page with regard to the definitions of our metrics. So in the beginning, we had metrics like, let me see, meeting attendance includes stakeholders from 3 different sectors. Well, define sectors, define stakeholders, define, like there's all these elements of that metric that require definition. So we work together and we hash it out. I mentioned the feasible low-cost metrics as clearly an issue. Staggered implementation efforts for sure. We're allowing that freedom and flexibility in terms of the way in which people do their various activities, but we are asking that all of our communities address all of the pillars in the model. But that doesn't mean that they're going to necessarily be able to do it all at the same time. Maybe one community came in, really strong on lethal means, and another community just wasn't there yet. And so, for that community, just building up to be able to do something in lethal means is, movement. And so we've got these sort of staggered implementation efforts of communities at various places. It's an issue. We have pre-existing community differences kind of related to that. Community differences in political will also related to that issue. excuse me, as well as others like DEI, for some, for some of our communities, just using the term diversity, equity, and inclusion, or for our rural communities, can be really politically loaded. So, we have to like watch our terms. We have to, just have these shared definitions. We have to have these conversations. And funding and capacity issues as well. Some states are, really great grant writers, right? They're able to secure funding, not just from us, but from other places. They've got deeper pockets. They've got folks in their catchment area who are willing to fund them, able to fund them. So that feels, like an issue with regard to the states and to the counties that we work with. Next slide, please. All right, and this is where I turn it over to Felice. But before I do, I just want to take a moment and make sure that there are no questions with regard to background and kind of that big frame that I just gave you.
There was one question. Oh, sorry.
I was just going to say there's one in the chat, but you already got it.
Yeah, curious about how counties who weren't selected reacted. Love the targeted approach. Thank you, Annette. Yeah, that's a great question. So I will say that we have recently added 2 new grantees, which is in their catchment area, includes 5 counties. And so we are growing. I don't know that we've heard any kind of specific feedback from counties who were not included in that the first 2 rounds. I think that, we really have tried to communicate this and initially I think we reached out to those 6 counties. So it wasn't like a broad kind of RFP that went out across the state. But really trying to communicate this as we're looking at those counties that have that really high burden for suicide and opioid overdose, and then have some kind of capacity there to implement, just kind of like the framework itself. Kristen, have you heard anything in that regard about other counties?
No, I mean, I think, I was there back in the beginning when we were making these choices. And I think that because they were data informed, I think people get that. And so for the most part, right, with some education, I think if you say like, hey, listen, these six counties, initially the 6 were selected because they were the highest risk counties. We're putting the resources in at the spaces that need the most. I don't know that there was too much pushback on that approach. So that seemed okay. The newest round, Felice, I'm a little less familiar with how Colorado selected their 5 new counties, or if there was any pushback in that area, but I don't recall hearing anything.
Yeah, I mean, I think we did do an RFP for the newest round, and we sent it wasn't statewide. I think we sent it to specific counties that kind of met some criteria of having burden and having some capacity. And so I think that's but we were really transparent about that. So I think the transparency helps, that, you're just clearly describing how the decision-making process is working.
Could you give us a sense of the scale of funding and technical, because some of it was technical assistance provided to counties? What motivated participation on the county's part, other than the importance of the work?
Yeah, it's so hard to quantify because we used rated funding streams, particularly in the beginning. AFSP had some influx. They funded a little bit. They funded a position at the state level to help with coordination. At one point, at a lot of points, honestly, we were volunteers. There were a lot of it was, myself and Jerry Reed and other folks at the national level who just said, this is really important work. And, and at the community level too, I think there were some folks who were just so bought in that they said, okay, let's run with this. But a lot of times, I think one of the carrots is the way the state braided the funding, the way they would distribute the funding. For example, their GLS or their zero suicide funding was to concentrate on those 6 counties that were of highest risk. And so those counties had an influx of resources. And so it may not have come from a unified space, but it was coming from a lot of different places. So we did it that way. So the question in the chat too about a current funding, which our current funding is through the through the CDC with their comprehensive suicide prevention grants. And this model probably sounds familiar to, I know you guys have that funding as well. And the model may sound familiar to you because Deb Stone and all of our CDC friends, Alex Crosby, they were all part of the original team that conceptualized this model. And Colorado was the first place where it really got up and running. And so when CDC released its comprehensive suicide prevention grants, it did so with the knowledge that this was already happening in Colorado and kind of had an understanding of the way in which we did it. So that's so there's like kind of, I guess to answer your question, like there's been lots of funders along the way, and in lots of ways we've gone about this. But honestly, a lot of it is just brilliance on the Colorado OSP team in terms of their ability to take their GLS funding, their zero suicide funding, their funding in opioids, because our dashboard that you're going to see in a second that Felice is, in charge of, is funded through the ASTHO or not ASTHO through opioid prevention funding. And so, there's like a whole host of different things happening here.
Right. Yeah. And that actually like kind of leads itself nicely into like the contextual piece I was going to describe here. So when I came on board in around 2018, 2019, that time is weird these days. But we had just recently received funding from ASTO with a specific emphasis on that kind of dual prevention of opioid overdose and suicide prevention. And we were gearing up to secure funding through the CDC for the comprehensive suicide prevention. And so we really needed to get some pieces in place so that we could meet the kind of evaluation requirements and the data collection requirements of those grants, but also, just for our own purposes of evaluating this like larger model, this very ambitious framework that we're implementing. And I will say that to that point of, these different funders who are maybe have a different focus, different outcomes that they're concerned, or that they're funding, because we use that braided approach and kind of leverage funding from different sources, it can be a little bit confusing on the back end of like, okay, these are the strategies that are funded through this funding source. And so this is what we have to report on to this funder. And then these are the strategies for this funder. And so it feels a little piecemeal, but we knew that we needed this comprehensive evaluation too, that captured kind of the whole kit and caboodle of what we're doing. So that's where I kind of came into the process, as we were just kind of starting to think that through. We also knew that like we had some really great work already happening on the ground. So there was this immediacy of like, we need to be capturing what's already happening. And so that's why we chose, when we were going through that, collaborative participatory process, we chose to really start with focusing on those process metrics, or what we sometimes call in this dashboard strategy metrics, so that we knew what was happening on the ground. And with 20 different strategies across these 6 pillars, with a bunch, with activities and sub-activities, like you can understand it was a lot. So we needed to just kind of dive in and start gaining consensus around how we were going to measure success for this model. And then again, we really wanted to utilize that same collaborative approach that was used to create this model in the first place. I mean, that's how folks came together from the local side, from the state side, and the national side, was to, they had several planning meetings, I think, or at least a couple where people came together and said, this is what we really need. Here's what the evidence tells us, looking at that suicide prevention technical package from the CDC and other resources, and just thinking through what's going to work practically in these different environments. And then, of course, the building capacity at the local levels to evaluate these comprehensive efforts. And so that includes, collecting data. A lot of that is the relationship building piece. And so you have to be very careful about how you go about that. You can't just, show up and say, hey, give me your data, and you have to share back and thinking through, how do we interpret data together, and how are we good data stewards? Next slide, please. So Kristen kind of touched upon the data dashboard we use. I will say that that's, one of our primary vehicles for the evaluation work. It is a web-based platform. We do have it password protected. So each county has their own dashboard specific to their kind of local context. They have a certain number of users that can access that dashboard, and they can choose whether they share those data with their local partners. We chose to do, first of all, the platform that we use is we're graciously allowed to use this free of charge, because we have that kind of dual focus on opioid overdose, which the Colorado Consortium for Prescription Drug Overdose Prevention has this kind of master enterprise license that they let us, work on, because we're working on that opioid overdose as well. But part of it is, the limitation of that dashboard itself, but also, some of the data that we have there can be a bit sensitive. And so I'll talk about that a little bit later in the presentation, but just wanting to, sometimes if you provide data and you don't have someone kind of there to explain what you're seeing or talk about variability, those sorts of things, it can be misinterpreted and potentially cause more harm than good. And as I mentioned, each county has their own dashboard. What's cool about this is that we have a state dashboard where we can take each of the 6 counties. Well, now we have 8 grantees, and roll up their metrics to that state level so we can understand our impact across all of our grantees. The other thing that's great about the dashboard is that each grantee can customize their own. So, as we talked about, we had this process where we went through and we, drafted different metrics, then we prioritized, we voted on which ones. And for each strategy, I would say it's anywhere from 3 to 5 metrics, depending on the strategy. And we call them kind of our required metrics because we needed everyone to be using the same yardstick across all the different counties so that we could roll that up at the state level and understand our impact. But in addition to that, they're able to add additional measures that might speak more to their local partners. They may be more engaging. They might have something that's, a project that's unique in their county that none of the other counties are doing that they really just want to make sure that they can capture. Excuse me. So they have that ability to like customize it and make it their own. And then the other thing I'll say is that this dashboard is interesting in that it straddles the line between a project management tool and a data visualization tool. If we're, I called the dashboard our vehicle. If we're using a vehicle metaphor, it's not a Ferrari for either of those things for project management or data visualization, but I'd say it's like a station wagon. Like it gets the job done. It's very utilitarian. And it allows us to, this bi-directional flow of information. So with your typical data visualization tool, you're just pushing data out and people can view it and they might be able to filter and select different views, that sort of thing. But with this tool, they're actually entering data in. We're getting numeric data, we're getting qualitative information. And then it also allows them to kind of assign certain metrics to certain people so they can use it more as like a project flow of like, this needs to be done by the state sort of thing. We tend to use it more on the data visualization end and less in the project management because we're still kind of getting our feet under us, but it has a lot of capabilities that we haven't yet scratched the surface of. Next slide, please. So this might look familiar. This is what we call our strategy map that within the Insight dashboard, the data dashboard. It is essentially that logic model that Kristen showed you earlier. It's just kind of flipped vertically. And this is just the way that they tend to use them within that platform. But you'll see, at the bottom, we have our community assets, our inputs that are, feeding into all of the different strategies that are housed within those 6 pillars. And then that is then kind of impacting, they call them strategy outcomes here. I prefer to call them, our midterm outcomes or our risk and protective factor outcomes, which are then in turn impacting our long-term health outcomes and impacts. So our suicide, opioid, and firearm related morbidity and mortality. And then let me just make sure I'm not missing any notes. Yep, I think that's good. Next slide, please. So what's cool about this is that, I think it's a great tool when you're engaging with new partners and maybe you're orienting them to the work. Because you can explain, like maybe you're meeting with a partner who is involved in, quality childcare, and you're trying to describe how that work relates to suicide prevention and how it might relate to somebody who is working in schools on social emotional learning or something like that. So this is like kind of this broad view of like how all of these things work together to then, impact suicide, opioid use, firearm mortality, that sort of thing. And what's even cooler is that it's interactive. So you can click on any of these buttons here relating to the strategies or the outcomes. And at a glance, you'll get kind of a little pop-up with all the different ways that we're measuring that work. So you can see the different metrics we use. You can see like what the current value is, if it's changed between the last time we collected data on it. So it's just, in a nutshell, it's a nice way of orienting folks. And so Jill, I'm not able to link to this dashboard because as I mentioned before, it is password protected. So these are for our grantees. We do have these, I'll get to this in a little bit, but we have these kind of online pillar reports that we'll talk about, which are meant to be more for external audiences. Those are in the works, but we're hoping to have those to share with folks in the future. I can share with you, some of the evaluation documentation, like our planning, or we have like an evaluation summary that has some of the metrics that we use. That might be interesting for folks as they're building out their own evaluations. And sorry, I know I'm missing some questions down here. Hopefully we can circle back. And please feel free. I'm totally happy if anyone wants to pop in and ask a question directly. I like it when it's more of a conversation. Next slide.
Can I ask a question then, since you opened that door?
Sure. Yeah.
What level, so on this chart, I can't quite read what it's like number of local policies that something or other. What
Right.
what level is that attached to? Is it like the strategies or the strategy outcomes? Like where are we measuring?
Yeah, this pop out, I mean, when I did the screen grab of this, I failed to, this looks like economic security and then food security initiatives, I think, based on what that is. So these are really the process metrics. So that middle section where it says strategies, that's the level that we're looking at right here.
Thank you.
Sure. All right, any other questions before we go to the next slide?
Hi, this is Annette, and I guess one of the things I'm so struck by the fact that we've struggled with what to do with that sort of pillar around economic security and basic needs, et cetera. And I just would be interested in hearing a little bit more about how how you integrated that into the suicide prevention approach.
Yeah, I mean, I think I would say in the branch that I worked in, which was violence, injury prevention, mental health promotion, across all those different programs within that branch, we really had a concerted effort in the last like 4 or 5 years to really focus on economic stability and supports. And for some different outcome areas like suicide prevention, this was kind of an alien thing. So it's different. And I think, with the collective impact approach, oftentimes you have partners that don't normally work together. And so often we really just try to like get at the background of why is this a risk factor for suicide? And so kind of getting buy-in on the research behind it and the connection, the link that we know exists, and then really thinking through what are the ways as this coalition we can kind of support and amplify and expand the reach of the work that's already happening. So be a connector, because obviously, most of the time, like this is not work that we as a suicide coalition are owning. It's other partners. But we do find, by going to their meetings and sitting at their tables and being a part of those discussions, we find that there are ways that we can help, whether it's connecting to different areas where we can increase referrals and supports, those sorts of things, or helping with data so that folks are understanding the connection better in that sense. I don't know, Kristen, anything you would add to that?
No, you just touched on what I was going to say, Felice, which was, making sure that we show up at their table instead of expecting them to come to ours seemed to be a really big win for us. And also the just language, I think, and understanding of what a public health approach is. And yeah, I think doing some education around that was helpful as well.
Mm-hmm.
So and also just letting our partners know, we're not expecting you, coalition, to go and do economic supports. There's already really great economic support work happening. It's about linkage. So all stuff that you already said, Felice.
Yeah, for sure. And I mean, I think there are, and it's really, we've had to be really precise and had to revise our metrics and our work as we go to understand what exactly is our lane here too. So can we support policy initiatives that are going to help expand supports for food security or affordable housing, that sort of thing? What can we do to help in that arena? Whereas we're not going to be the ones directly kind of implementing those supports. Okay, next slide, please. All right, so this is another view of what our dashboard looks like. And this is primarily where we do our work. This is what's called a scorecard. And I'm sorry if you hear my dog snoring in the background, but he's in a really intense dream right now. But it is essentially the logic model, the strategy map that we were just looking at, but it's in list form, and kind of just, you go down the list, you've got your different, what they call objectives, we call, strategies, but main headers. And then below each of those headers, you've got the metrics that you're using to capture the impact of that particular strategy, or to capture that outcome. So let's see, if you click on one of these measures, you'll see that you've got some trend data, which is great. You've also got a target value. You can see where you're at with the target value. This is a limited screen grab I have, but if you were to scroll down, there's a section where there's a description, so you understand what is this measure that you're looking at, where did the data come from, who's collecting this. There's also an area for comments that, this is for a mortality metric, but for those strategy metrics, our local partners use the comment section often to really describe, who are they connected with, who was included in this particular count or percentage, or what might be impacting their ability or inability to collect a certain metric. There's also, you'll see at the top, there is a way to edit. So if you click on the edit, that will allow you to add new data values to this particular measure, or add to the comments, or change the name, what have you. There's many things you can do there. There's also this embed feature, which is kind of cool. And I'll talk about that a little bit more when we discuss our online pillar reports. But that's a way so that you can embed that in another website and have it just kind of linked to that metric.
So awesome. Quick question. How do you go about setting targets?
So for these, it was kind of tricky, and we just did kind of a 20% across the board, because we knew our overall goal was a 20% reduction. I didn't, without getting into the weeds with each specific, midterm and long-term health outcome of what those needed to be in order for us to reach that 20% goal, we kind of just decided as a group, we're going to select this 20% and hope and shoot for that as our North Star, aim for that. It gets a little bit trickier when we get into those strategy outcome, the strategy section with the process metrics, because some of those are related to contractually, like for a QPR training, like they may have in their contract with us, they might be responsible for doing so many QPR trainings for the year. And so that's what the target would then be. But not all of them will have that contractually set. And so often I think it's, what you can agree with your partners locally is this is a good target value for us for say QPR trainings. And I would say often for the process metrics, it ends up being left at 0, because we just don't know that they haven't had those conversations yet with their partners. And so we're kind of holding off. But, if we've got data for it, that's the most important piece. So we're not trying to harp too much on the target values. Okay. Let me just make sure I'm getting everything. Yeah, and then I do want to just make a note that this metric that I kind of took a screen grab of for the pop-up, this rolling 3-month average suicide rate, this is a metric that is prepared for us by our partners in our epidemiological partners in CHED at the Department of Public Health, Community Health and Environmental Data, which is lovely that they create this for us. It's a more timely metric. So rather than, those annual rates having to wait a year, or having to wait a long time to get those yearly metrics, these come out. There's usually a 3-month lag, and then on top of that, they merge these we take an average of the 3 months together, so we have a more stable estimate of what the suicide rate might be. Even then, we still have quite a bit of variability. But this is one of the reasons why we're pretty protective over our dashboard and the data that we share, because we know that sometimes, especially with local media, if they don't have good guidelines about how to report on suicides and suicide data, it can become very alarmist. And, if you see a spike in December or January, folks will start ringing alarm bells, and that often is not helpful and not the message that we want to be sending out to the community. And it's also, a natural fluctuation that occurs over time. So that's why we have these conversations often about being good data stewards with these data, so that, we want them to have timely information on what's happening in their counties, but we also want to be responsible in the way that we're sharing it.
And please, I just jump in to say that data literacy has been a huge part of our approach too, because I think, there's data literacy, and then there's data literacy in suicide prevention. And I think there are so many nuances to the way in which we need to interpret suicide related data that we have to do a lot of education. We still have partners who've been with us a really long time who will say to us, oh gosh, we saw that 2 less people, died by suicide this year as opposed to last year. And we have to have conversations about small lens and interpretations. We have to keep circling back to that. I think it's a really hard thing for folks to, kind of grasp. So that conversation is something that is just ongoing all the time. And particularly now we've got new partners. We want to make sure they're on board. And my big dream ultimately is, as we think about the ways in which we present this, not this specific information publicly, but information about the Colorado National Collaborative and, and what we've accomplished publicly, is that data literacy will be a part of that as well. So, because if we as, public health professionals are having trouble wrapping our heads around suicide related data, the general public is really going to, they do, as well. So that data literacy component is just so important to us. I'll get off my soapbox, but that's my favorites.
No, absolutely. And then I'd say, we don't include our annual suicide rates here because we already have a really lovely suicide dashboard that was created by our partners in CHED, who I just mentioned, that is a great resource. And so we didn't want to duplicate great work that had already been done, and in a fashion that's, again, for data visualization, it's not the most sophisticated of platforms. And so just wanting to provide something that's new and novel that could be useful, especially when we're talking about ED visits and hospitalizations, and the postvention work. Like we have specific applications where we think, hey, it might be helpful to have a little bit more timely data related to this. Okay, I think that's everything I wanted to say on this slide. If we want to progress to the next one. Okay, so these are the online pillar reports that we have been talking about, or I've mentioned a couple times. So this came about, we had some folks give us feedback that when they're in that dashboard and they're looking at those lists of metrics and they're seeing kind of all these figures stacked on top of each other, that it can feel a little overwhelming, and that they're not always sure of, what to take away from that and how to make meaning of that. And so what we decided to start doing was creating what we're calling our online pillar reports. And so we have one for each of the pillars. So connectedness, economic stability supports, education and awareness, et cetera. And then for each of the county, they have their own kind of specific report. And this is, these are still in the works, but it's web-based. And what we're doing is we're incorporating more storytelling, so qualitative information coming from that local perspective. They can include more, pictures or videos relating to that work and really kind of make it their own. And then we're pulling data directly from the dashboard and embedding it in that web page so that it's a mixture of data, but also some good context, and content from that local perspective, so folks can really interpret it. And we're hoping that this, from a data equity perspective, helps with their local partners. So those folks that we're kind of asking for data from on a regular basis, if we're able to give something back to them and say, hey, this is how we're using those data, this is why it's important, and this is how it's kind of feeding into some of those more downstream outcomes that we care about. That's the ultimate goal. And again, like they could make these their own. They're up, we provide a template for them with some basic images and try to make it look good so they have something to start off with, but they're really free to kind of put their own spin on it. So we're still working on it. Now we have, instead of 6 counties, we have 15 counties and 8 grantees. So a few more to do here. And we've got at least 2 of the pillars, the reports in web format, and the rest are waiting to be built out. So it's a process, but we're working on it. Let me just make sure. Yep, I think that's everything I wanted to say about that. Thank you. So now I'm going to switch gears just a little bit and kind of talk about from the side of our local partners. So, this information comes from one of our partners who provides evaluation support for one of our counties, Larimer County, who is like actually one of our, star counties. They had prior to joining the CNC, they had already had a suicide coalition going on for 10 years. And so they had a lot of structure and a lot of good foundation for this work. And sorry, I have some, they're not like live, they're more in Google Pages form, and that's how we're working with them. But I do have some images of the online pillar reports that I can share with folks after this. So we wanted to kind of, get at some of the challenges that they have and some of the solutions they've created to, what is a pretty comprehensive evaluation and comprehensive framework that we're utilizing. What they were feeling like is that there was, a pretty considerable burden for data collection on the local end. And especially in these larger counties where there's a lot of partners, they really wanted to think through different ways they might go about partnering with other folks to collect data and doing this in the most strategic way possible. And so what you're looking at here is kind of a little screen grab from an environmental scan that they did, which was to help them identify, and this actually I think was from El Paso, because that same partner supports El Paso as well. El Paso County has the Air Force Academy in it. And so we know that there's a really large service members, veterans, and their families community in that county. And so just trying to wrap your arms around of those organizations which are offering peer-to-peer recreation, community service, or meaningful engagement activities, that's one of our metrics. And so what they did is they sent this kind of Google spreadsheet that was just, kind of a simple form where folks could identify which of the organizations they knew that were providing that. That was one of the ways they did this. And I will say that this is a great example of, a metric where we needed further definition. We needed to refine it a little bit and operationalize it a bit. So our current definition or our current metric reads partner organizations serving service members, veterans, and their families, because what we discovered is it just made it easier for us to wrap our arms around. If if you're in a place like El Paso where there's hundreds and hundreds of organizations, it's not an easy feat to know this. And so if we say partner, what we mean by that is the organizations and are connected with and have the ability to ask this question of like, do you have these peer-to-peer recreation services available? And so it gives you a denominator, and that denominator might change over time, but we can track that within the qualitative information for these metrics. So we, if as they become aware and become connected with more organizations, we just have them kind of keep a running tally of, here's our denominator as we go. The other thing I'd say is for meaningful engagement, that was one of the terms that we needed to really operationalize as a group of like, what do we mean by meaningful engagement? We don't have the definition here, but that is something that we've got like a list of terms that we just went through and said, okay, here's how we're operationalizing this. So we're all on the same page.
And Felicia, I just add that one of my favorite things about our dashboard too is that regularly Felicia and I take a look and we see, okay, if only 3 out of our 6 partners or whatever, of our 6 counties have filled in a specific metric, let's take a look at why, and that helps us identify those metrics that are causing problems. We bring that back to the evaluation team and we say, listen, this metric seems to be left blank. Is that because you're not working here yet? Or is that because you're having a problem with defining the metric? So in addition, it's sort of a two-way street. We have people bring their metric issues to us, but we also take a look at the reports that are being generated and we say, oh, this metric it doesn't seem right. The counties seem to be filling this in wrong. There's vast discrepancies between the counties and the way they seem to be interpreting this metric. So it's a work in progress. And that's part of why this is a feasibility study, right? Like we recognize that the metrics may not be consistent over time, right? Like they may have required some definition in the beginning, and so they've changed. And we're okay, we're tracking that, we get it. And I think that it's still gonna be very useful because we can report all this back out to the counties once we've refined them. And we're establishing a process whereby we have established metrics that are well defined, that, it's got a lot of value, I think. So, that two-way street, I think, is a very useful technique for understanding, when the metric needs to be looked at again.
Yeah, and I will say, I think Kristen and I do a fair amount of, there's anxiety on the part of our local grantees at times with like the messiness of the data collection. And so having to reassure them that like, this is part of the process. It is, again, it's that feasibility piece of like, we're really seeing, can we evaluate this and what's the best way to go about that? And that does mean shifting course sometimes. And so I think, a lot of our partners want like, that perfect metric that's going to perfectly measure a thing. And we know in like, even in hard sciences, sometimes it's really hard to like perfectly measure a thing and know a thing. So I think a lot of our work is in reassuring folks that this is part of the process, and that we sometimes got to get our hands dirty a bit. Yeah. So environmental scan is one of the solutions that our local partners have put into place to kind of capture some of those data that we ask them to collect. Next slide, please. And then another solution that several of our partners use are their own local surveys. And so this is a way that they can, within the folks that they're connected to in their network, they can send out a simple survey asking about the types of work that they're doing. And often, I think they use more sophisticated methods to kind of streamline the surveys and have branching logic so that they're asking questions that are really specific to the areas, or we'll say our pillars that they're working in. So we wouldn't ask somebody who works in childcare to answer questions about food security, that sort of thing, or about postvention. I guess that's probably a better example. So really trying to like tailor those surveys, but really understanding, within organizations where folks are working, what do the policies look like, and what does the prevention environment look like? And then I would say that this is a nice complement to surveys that we also disseminate. So we have, we call it a local partner survey that's administered from the state level that is really getting at, different types of things. So not so much the work that's happening on the ground, although maybe a little bit, but really looking at the quality of relationships within the coalition, looking at representation and inclusion for those who are within the coalition, and looking at their kind of comprehension and ability to implement the CNC model. So we're trying to balance these so that there's not, overburdening with surveys, but I think we found a good balance where they're not, neither of the surveys take too long to complete, and the one that we administer is once a year, so it's not too bad. Let's see, what else did I want to say? I think that's the main points I wanted to make. Anything you want to add to that, Kristen? Nope. Okay, cool. And then, so other solutions, sharing tracking tools. So these are things, think more like administrative data. So things that you're already kind of collecting, our local partners might use, attendance lists from meetings or meeting notes to kind of capture some of the work that's happening. And again, a lot of that has to do with them having good relationships and good communication with their partners. And so also looking at, using their current communication processes like newsletters, those sorts of things to ask questions and to kind of open that pipeline of information. And so they know like, hey, we're wanting to know what's happening in this regard, or we've got some work happening in this pillar, what folks are involved in that. And so, some of the things that we look at are like really understanding those cross-sectional meetings that are bringing folks together from different disciplines to address, a similar outcome, whether it's, again, in the economic stability realm, or, you know, something having to do with connectedness in schools. But those are sorts of things that we can use, you know, we can try to leverage data that we're already collecting to answer some of those questions. And then the other thing I would say is that really thinking about dividing responsibilities. So we have some counties that are really good at this. They have, you know, through their funding, they'll choose to like fund a part of an FTE for different people to really head up work groups that are specific to each of those 6 pillars. And so you have someone that's got some devoted time that can then, you know, kind of bring together folks who are within that work group to help divide some of the responsibility for collecting some of these things, or to, you know, use that network as a way of collecting some of that information. And so I think we see a lot of success in counties that build in as much as possible funding to kind of diversify like who's actually doing the work and collecting the data. And then, you know, how well connected are they with their work groups, or is it just them? Do they have folks that they're working with who are already in that space, who are doing the work, and they're able to ask those questions of them? But so that it's not all on just one person who's the coordinator, who often is like the person who the buck stops with them in terms of implementation and evaluation. So if you can kind of diversify and have somebody specializing not only in data and evaluation, but specializing across those different work areas, it's super helpful. And then I saw a question pop up. Yeah, let's see. Resources, right. In terms of funding, I mean, it's not, and given how comprehensive this model is, I think that I will say we're not fully funded. Like, I think all of our grantees could use more money to do this work, absolutely. And our ASTO funding did end in 2022. And so with our most recent kind of continuation applications, our grantees got a little bit less money. I would say anywhere in the realm of, you know, 100K to 200, you know, depends on the size of the county and the work plan, and what the kind of burden looks like. So not everyone gets an equal amount, but, you know, somewhere around that range of funding, you know, 100 to 200K a year. And I think every one of our counties could use more money and particularly more FTE to do this work. But, you know, we're trying to utilize what we have through CSP and through some of the state general funds. And I think, you know, the idea is to absolutely provide capacity and ability, you know, through the implementation, but through the, you know, partnering of the backbone agency for them to go after new funding resources as well. And so that's one of the outcomes we're definitely interested in is, you know, how many different funding like applications or proposals were maybe like, did the coordinator go after, did the coalition go after, how much of that did they obtain, you know? So we're really hoping that this provides a good foundation with which, you know, it isn't totally reliant on the Department of Public Health to provide funding, but giving them a tool and a way to, you know, a way to go after new funding and keep this as sustainable as possible.
Yeah, and sustainability is certainly a worry for our communities, particularly, you know, the CDC funding is, you know, we're in our 3rd year fully. So, you know, counties are starting to feel, oh gosh, we're heading toward the end here. And what does that look like for us? And, you know, so there's certainly some angst about that. And so I think part of our sustainability plan is going to be informing folks, teaching folks, building capacity for you know, seeking out funding, you know, both locally and state in the state. And that's part of the reason the national partners are on board, right? So we can make that, you know, kind of work on the advocacy, you know, at the federal level for, you know, for continuing the CDC funding in this stream of work, you know, identifying national partners like AFSP who are able to, you know, kind of fund some of these efforts. So I think that the beauty of this local, state, and national approach is to make those kinds of connections and hopefully be able to build the capacity of the local partners to say, hey, we've got resources, we've got connections at the state level and at the national level, and, you know, leverage that for identifying, you know, spaces and places where they can fund their efforts.
Yeah, absolutely. Yeah, having like a framework and like a vehicle already kind of built of like, we need the resources to fully support this, I think is an advantage for sure. Okay, I think next slide. So some of these we talked about already, but I just wanted to kind of, go over how we have identified and addressed some of the barriers and challenges that have come up. So I did, I showed some of the online, or I talked about the online pillar reports, and happy to share an example of what that will look like with folks. But really, again, like noticing that our partners are not all, they don't consider themselves particularly data savvy and aren't evaluators or data folk. And so really providing another way for folks to engage with the data that's a little bit more user-friendly and accessible and engaging. And so that was our solution to that issue of just like not wanting people to have to look at lists and lists of metrics. We also noticed that because what we're doing is so comprehensive and there's a lot of history to it, right? So Kristen did a good job of talking about the evolution of the CNC and where we started from and where we're at. But I think, when new partners come on board, there's a lot of new information coming their way, and just even orienting themselves to the model itself with the 6 different pillars and all of the strategies and the activities and those sorts of things can be a bit overwhelming. So currently we just tend to like meet with folks and go over the dashboard and go over the pillar tools, those sorts of things. But we are working on a more formal kind of orientation manual and materials that specifically new evaluation members can reference, so they can see, like what are the tools we use to actually move through that prioritization process? How did we get to where we're at? Because, for the folks who have been around for a while, they're bought in, they were there, they helped decide on those metrics. But for the new folks, they weren't a part of that process. So they might feel less bought into the decisions we made previously. So we want to give them an opportunity to get caught up there. And then in terms of the metrics themselves, understanding that it's complex throughout this process, which is more of a feasibility process. And, we're shifting metrics, we're refining them, we need to have a good, place to store that institutional memory of like, what were the decisions we made? Why did we make those decisions? And how did it shift over time? And so we have a data dictionary that is almost ready to share that really gets at, what are all the different metrics? Who are we, like, who's interested in which metrics? Like some of these are being reported out to the CDC. Some of them are just for our use, and how have they changed over time, and why did they change? So those sorts of things, and, where are they coming from? What are the data sources? So just all the good stuff you would want to have in a data dictionary. And then I think, a couple of the things that we'll be continuing to think about that like are not necessarily things that we've, found a finite solution to, but ongoing topics for us to discuss, or thinking about how we balance the local data collection, the burden of what we're asking them to collect, with the capacity building. And so there is a desire to, we want, when we're talking about sustainability, it's not just financial sustainability. It's looking at, capacity to evaluate, to collect data, to, have good processes in place, and to be able to interpret those data and make decisions. And so we want to the best of our ability, provide tools for our counties to do that. And we also recognize that some counties are in different places than others. And so sometimes a little bit more support is necessary. So it's not a one size fits all type of thing. And then lastly, I would say, really wanting to lay the foundation for more rigorous forms of like inferential analyses. So really looking at impact of the work that we're doing. So like wanting to see the so what of like, we've done work across these 6 pillars. We've captured data on all the different strategies and activities and sub-activities, those sorts of things. And how is that impacting the outcomes that we really care about? And so making sure that we have a really rigorous, that we can build ourselves up in the future to be able to very rigorously evaluate that and research that is my goal. So I know Kristen's too. Yeah, and then I think that's the gist of what we're what we're thinking about now in terms of addressing barriers. And then yeah, feel free to go to the next slide there. Thank you. So in terms of what's next, as I mentioned before, we are growing. We recently added on new communities. We've got 2 new grantees that consist of 5 new counties. So that's kind of a different thing for us, a grantee that it isn't just one county, but several counties. And so there's a lot of nuance and complexity there. We'll be continuing to refine metrics. Our last evaluation meeting was spent entirely on that. So really looking at how do we assess progress as well on our equity and anti-discrimination work. I think we've got a good process in the way that we do our work, but ensuring that we have the right data at our fingertips to know how well we're doing our work, especially as it relates to equity and anti-racism. Again, refining metric. We have over 175. Not all of those are the responsibility of our local grantees to collect. A lot of them are on us as state and national partners in terms of those midterm outcomes and long-term health outcomes and impacts. But then thinking about what dissemination might look like. So should we show some efficacy, some initial evidence of feasibility? How do we share this out with a broader audience? I think having these conversations with folks like you is a great way to start talking about how applicable this might be to your work, and if there are any elements of it that resonate with you, and just hoping to make everyone's work in this realm a little bit more strategic, and also learning from others and how they're doing similar work, and how we can incorporate that into our model. And Kristen, please feel free to jump in.
No, you got it. That was great, Felice. Thank you.
Okay.
And so I'm seeing that, I know we're over time. I apologize because I see we've gone 15 minutes over. I was chatting with with others just to make sure that we were okay on that. If there are questions in the chat that we didn't answer for you, I want you guys to be able to go on with your agenda. Please, send those our way. Compile them. We'll get to them and continue this conversation via email. I'll put my email in the chat so folks can respond directly if they want to as well.
Yeah, and I just had a question. This is, excellent and a lot to process. Can we call you back again for further in-person conversations as well as email?
Absolutely. I mean, I know, yeah, for myself, I'll definitely speak for myself and say, love talking about this, love working with other people who are struggling with the same questions. And I'd love to know more about what your questions are, like what you guys are struggling with, to make it more of a two-way conversation. So yeah, I would love to continue this collaboration.
Thank you.
Yeah, same. I think, yeah, and especially if it's if we're wanting to focus in more on one piece of it, because I know this was a lot to cover, and so I understand if it's feeling a bit overwhelming. But if we can do a deeper dive on any area of this, of what we presented on, I think I love talking about this, as you can see, since I went 15 minutes over.
We are so grateful for your time. I am going to reserve the final 15 minutes for some committee work, but we are so enthusiastic about your model, see tremendous potential for our own work here in Oregon, and hoping that we can stay in conversation so that we might begin to chip at replicating some of your work here in Oregon. So I will follow up with some final questions in the chat. We are just so grateful for your contributions, and feel this is groundbreaking work.
Thanks so much for having us.
Mm-hmm. Yes, thanks so
Talk
much.
to you via email.
Talk soon.
Bye.
Bye.
Okay, I have collected some additional questions in chat. I do want to be encouraging of folks being able to reach out with our presenters individually as well, and you all do have a copy of the presentation. I do just want to go around the room just to see where folks are at based on that presentation, what in particular resonated with you. And I am Gonna pop on some slides quickly. If Jen could share with me presenting powers.
You should be able to, but let me know if it doesn't.
Okay, super. Does anyone want to share just 2 words about, can we just go around the room and do that? Yeah, Kathy?
Structure and depth. Those are my 2 words. That's what I was so impressed with.
I love that. Anyone else wanna?
John Seeley, what did you think?
Oh, I was very impressed, and I have 3 words: research, practice, partnerships. And they do an excellent job of demonstrating that, especially with their community-based participatory methods. And yeah, this is how it should be done. Very impressive. Thanks, Alyssa, for arranging this.
Yeah.
Impressed with this presentation.
Others? Yep.
I'm going to say targeted and participatory, both, that they did both things.
And this was Karen. I'm going to say that it's really useful since Oregon has some of the same funding streams, to sort of hear how you've been approaching those evaluations. So thank you so much.
So I am now going to attempt to do a like 30-minute presentation in 5, which is absolutely ridiculous. So just bear with me. But I do want to get these few slides up in front of you while this is just so fresh in your head. So again, shared measurement is share results against common metrics, learn from each other, refine individual and collective work. And what we just saw was exactly this in practice. As we look forward to 2023, a big part of what we hope to do as a committee is to develop shared definitions and data, understanding metrics, measures, and surveillance, differentiating process from impact. And this was a presentation from months ago before our fall break. And these were some clear things that we are working on. We now have a data orientation for Alliance members, thanks to Taylor and Megan's presentations. We know a data dashboard is in the works, and YSIP metrics developments continue. This is all in line with this presentation. And then this is from our presentation last week. Again, I'm just trying to keep us on tasks. This is the steps that they use to develop their metrics, defining terms, exploring existing data sets, identifying potential measures. And those first 3 steps is where they're at. They shared with us that these are the outcome measures system of care is focusing on last week. And one way we could approach it is, how do we partner with system of care, knowing that they're doing those outcome measures, focusing first on those 3 green bulleted points? Well, perhaps we can focus on these 2 as being most relevant potentially to our suicide work. All youth have connections to their community. I'm following up on Jill in the chat. And all youth have access to diverse providers who look like them. And just so that you can see, we have measures that exist already. Outside of school hours, there's a safe place or person I can go to if I need help. Agree or strongly agree by grade, and you'll see that this is relatively stable across 3 grades in the state of Oregon. But then if you go, and again, I'm talking so fast, so apologies here. If I go to the data dashboard, just give me a minute as I pull up the data dashboard. and you use the crosstabs feature in the school health survey, you can see some significant crosstabs based on what language you use most often at home. So among our English speakers, 55.6% strongly agree that there's a safe place or school. And if you combine strongly agree and agree, look at how high that number is. It's close to 95%. But there are significant disparities with, for example, our Russian and Vietnamese home speakers by far having the greatest numbers who disagree that they have a safe place to go outside of school hours. And you'll also see a protective factor among those who speak an American Indian or Alaska Native language. So it is that type of data diving and metrics linking that we may be able to do in future. So that is just an example of the connectedness work. And then moving further along, when we think about young people having access to providers who look like them, here is another disparity available in the Oregon Healthcare Workforce Reporting Program. Race and ethnicity workforce, you can see a large disparity for our Hispanic and Latino members compared to the Oregon population. So just again, indicating that there is the opportunity for this committee to start diving more deeply into defining measures and data to monitor. So I am going to stop there.
Alyssa, I know at one point we had talked about, I lost track of it though, talked about doing sort of a practice session with the data dashboard. Is that still happening?
Yes, and it would be great to finalize a date for that now. I had put a date out there that did not potentially work for all. Would a March, it looked like a March 30th date might work for data dashboard practice. Who might be available on March 30th? And we were thinking an early morning meeting. That's Thursday. That would start at 8:30 in the morning to hopefully get things in before folks' regular day starts. Kathy, could you possibly do the 30th? Because I know that other date did work for you. And if you can't, maybe I just do 2.
The third, no, I can't do the third. I can't do
Okay, I think I'm just going to run 2 sessions
you're
because
wonderful.
that'll increase access of people to that. So we'll do 2 sessions, one, and I'll send that around to the committee. Again, just being respectful of only having 5 minutes and don't want to be the one doing all the final talking. So any additional check-ins from folks about this presentation? Any clear visions as to next steps after the dashboards?
You know, one thing I guess I think about is we've never really done what are the counties with the highest rates and where is the biggest need in our state kind of conversation. So at some point I would love for us to have a better picture of that. I'm sure that OHA folks have a better sense of that than those of us out here do.
The lab did a map a little while back with that. And I'm really embarrassed that I can't remember the human who worked on that. John? Camille?
Yeah,
anyway, it doesn't matter.
Yeah, that may have been Camille. Yeah.
I've also got a chart that I think it's for 2020 that ranks 36 counties, and it continues to show Curry County #1.
I'd love, you've probably shown it to me before, Gordon, but would love to see that too.
Will do.
I'd like to add a comment to Jill and Shanda. I think this presentation could be very helpful for the tech folks who are building the repository for the state. And so this is a really positive exemplar that I think should be shared.
John, do you mean what Alyssa just went over or the Colorado?
Well, actually both, but the Colorado.
Yeah.
Yeah.
Okay.